Businesses and Vaccinations. Today is Friday, August 20th, 2021.
Let's remember, the key tool to keeping our economy going strong is to get people vaccinated and at work.
President Biden there drawing that line between vaccines and getting people back on the job, but persuading employees who are still hesitant to get the shot is an uphill battle that a lot of companies are facing right now. One Arkansas company may have found the secret sauce. The owner of Hendren Plastics managed to get his 85-person workforce from a rate of 22% vaccinated to 92% vaccinated. And what makes this even more of an accomplishment, the CDC reports just 46% of folks in Arkansas who are 12 and older are fully vaccinated. So those people who work for him may well have family members, friends who won't or aren't getting vaxxed. How did his company do it? Well, it wasn't easy. With me now to shed more light on how they got it done is Jim Hendren, owner of Hendren Plastics. He also happens to be a state senator and a veteran. Thanks so much for being with us, because a lot of folks hearing those numbers, I'm sure, are amazed. When you shared your story, you noted that you hoped your experience would be useful for others. So help us, what were the factors, both personal and business, that you weighed when deciding to make this push to get your workforce vaccinated?
Well, thanks for having me and sharing the story, because I do hope it helps other companies succeed, because it is such a comforting feeling to know that most of your team is vaccinated. And I mean, the compelling motivation for me was I've known these people and worked with these people, some of them for 2 or 3 decades, and they're like family. And some of them have conditions that might make them very susceptible to complications. So I wanted it for their safety because I care about the people here. Of course, there's also the business part of it. It's so easy to get 4 or 5 infections. We're a manufacturing facility. Working at home is really not an option for us. And the idea that I would have to quarantine it could just shut us down very quickly. So there was the practical consideration and there was the personal consideration. But what I learned was there was a big barrier to overcome. There are a lot of people in Arkansas and in other states that still have incredible hesitancy to take the vaccine. And as I said, I was shocked to find that only 1 in 5, only about 22% of the staff was vaccinated when we began the process of trying to figure out how we could solve that problem.
I was in Arkansas about a month ago, and I went to a place where they had a lot of incentives, and it was shocking how few people showed up for what I thought were really enticing incentives. You offered, I think, $100 gift cards, and that didn't work. So how'd you do it?
Right. Well, that was interesting to me as well. I did what a lot of owners have done and what state governments have done. I said, I'll give a $100 gift card. I sent a compelling letter, what I thought was compelling for me, to the team, saying, look, this is important, and trying to lay out the case. And as I had about 70 who were not vaccinated, that effort led to 2. So I got almost no response for the $100 gift card. We were going to give it to them at work. No, nobody was going to lose any pay, try to make it as convenient as possible, but they were just not interested. So I realized I had to find a different approach. And that really involved getting my leadership team to buy into this, particularly my plant manager, who was not vaxxed and had real issues with it and concerns with it. And I spent a lot of time trying to work through it with him. And I'll tell you what made the difference, I think, to him and to others in my leadership team, was when they understood this isn't about you. You may be afraid and willing to take that risk, but you're also putting others at risk, your coworkers, your family, and in fact, our livelihoods, if we have to shut down and make hard economic decisions. When they understood it was about something besides themselves, they took ownership in it, and then they went and communicated this effort to the team. My plant manager, and then they brought me some other concerns. One of them was they had a particular concern about the manufacture of one vaccine, and they wanted another. And I have to tell you that our partnership with our hospital here, our local hospital, was tremendous. They said they would come. They changed the brand of the manufacturer to Pfizer, which is what, for some reasons, the people here were more comfortable with. We tried to listen and accommodate their concerns, and it went from 2 that decided to 70. So it was and of course, we did pizza, and we tried to make it an enjoyable time, and we tried to help people understand that this is how we make our business stronger and how we protect each other. And I'm just so proud of the people. And what's really been rewarding is to have several of them come up to me in the last couple of weeks and say, I was opposed to it. I had concerns about it, but I can't tell you how relieved I am now that I've gotten the shot. We allowed them to bring their spouses up and get the shot as well. So I hope it's a lesson that works in other places, because I'll tell you, it's great having a workplace that you know most of your people are protected.
And it's so fascinating because a lot of the doctors that we have had on our air have said the two most important things in getting people convinced to be vaccinated is take their concerns seriously, don't make them feel like they're stupid because they're not doing what you want them to do, and answer their questions, which is exactly what you did. Congratulations. And thank you so much, Jim Hendren, for sharing your story and your workers' story. We appreciate it.
Well, thank you for having me on. I appreciate it.
I want to bring back Dr. Kavita Patel and Dr. Derek Cass to answer some of our viewer questions. So, Dr. Patel, a lot of the employees who will be returning to work will be required to follow specific protocols. That includes wearing masks. Kim asks, how many times can I safely wear my KN95 mask before discarding it?
Yeah, Chris, great question. I love that story with Jim, by the way. That gives me such hope. So you can safely reuse your mask. You should try to just make sure, one, that it doesn't get dirty, crushed, or debris. And one little tip I've used personally is I hang my mask so that I hang it in the coat rack. My coat rack is filled with masks now. And it's a place that it can get air when it needs to. And if you see it getting dirty, you really should toss it away. Some people say 5 times is about the average, but you can safely reuse it. Just look at it and make sure that it's not dirty. And when it is, throw it away.
I did not know that. I've been throwing my masks away, so I just saved a little money here. Dr. Cass, this time last year, there was an absolute frenzy to purchase masks. But now with the rising cases around the country, a lot of questions are resurfacing about the level of protection. Michaela asks, I am not able to have a vaccination because of a medical condition. Does double masking and social distancing still protect me against the Delta virus?
So first and foremost, the best protection an unvaccinated person for a medical condition can have is that everyone around them is vaccinated. Adult children, spouses, anybody over the age of 12. Beyond that, yes, masking and distancing still work for this virus because those are the measures we've been using since the beginning before we even had a vaccine. So what I would say to her is yes, keep masking, keep distancing, encourage people around you to get vaccinated. And if for some reason things change and you can get vaccinated, please get vaccinated yourself.
So, Dr. Patel, as people are returning to work, there's this rising threat, right, of the breakthrough cases. Kyle asks, do people with breakthrough cases have an increased antibody response once the virus clears?
Yeah, great question, Kyle. I do not want to encourage people to try to get breakthrough infections, but we do see in limited studies that we've had so far, remember, breakthroughs are rare still, which is good news, but in limited studies, we do see increased antibody levels. However, Chris, we think that those people actually had lower antibody levels before they had their breakthrough infection. This gets back to why I think the country decided to move forward with booster shots starting in September.
And if people want a little good news before we go to break, here it is. We just got this in. We now today have hit a milestone, 200 million people with at least one dose get vaccinated. Dr. Patel, Dr. Cass, stay with us. Does just the thought of going back to in-person work make you anxious? Or maybe you're already in the office and it's stressing you out. We'll talk to a psychologist about the toll all of this is taking on our mental health and how you can make it a little easier next.